We have a great panel here of some of our nurse and nurse practitioner AAFE faculty here. And so I'd like to introduce Cassandra Koontz, who is a nurse practitioner, and Nick Greathouse, who is a nurse, and Jill Charles, who is a nurse practitioner, and Megan Hayes, who is a nurse and also a nurse practitioner school. And they are a little bit nervous, but I want them to share their story here a little bit as to how they got into aesthetics, what it's like, why did you decide to make a jump into this from your different nursing professions, and what attracted you to it, and how do you like it so far? So we'll start first of all with Cassandra, so you can tell everybody a little bit about where your practice is and what you do in your med spa and what you did before and how you ended up here.
Okay, so I was an internal medicine hospitalist, nurse practitioner. So I worked in the hospital. I got a little burned out. I had a lot of patients that were very, very, very sick, and they would not be very grateful, or just a lot of very difficult patients in the hospital. And I got a little burned out, and I decided I wanted to take my career a different path, somewhere where I'd feel a little bit more satisfied with my profession. So I decided to take some training courses on Botox fillers, PDO threads. Later, I decided to open my own med spa, which I have done. It's been open a little over a year now. I do a lot of different things in my med spa. I do a lot of chemical peels, skincare. I do oil therapy, Kybella, mesotherapy, microneedling with PRP.
And all the injectables,
all the
right?
Injectables,
all the injectables.
Yeah. Yep.
And how is it going? How's your med spa going?
My med spa is going wonderful. I love the career change. It's much, much different. Coming from anybody that's ever worked in the hospital, you know that medical professionals aren't really appreciated in the hospital. A lot of times we're punched and cussed at. And coming into an office doing medical aesthetics, where people are thanking you so much and so grateful for you doing their lips or things like that to make them have more confidence, is a complete change. I feel a lot more satisfied in this profession than I did otherwise. So I'm very happy with my career change.
All right, that's great. Okay, Nick, tell them about yourself.
I'm Nick. I am a nurse in Arizona. I got into this field because I was working in neurology, and we had patients who were treating migraine with Botox. And I found out that nurses could do that. So I got into it and found that I liked the cosmetic part of it, a lot more than being in the hospital. So slowly I tried to transition out of the hospital. I was working in the emergency department after that, and then just got busier and busier after I opened my med spa. And then now I'm fully out of the hospital doing this and teaching. So it's been a great change.
Right, and you're building a new med spa,
yes,
right?
It should be open in the next week or two, hopefully.
Right, so, that's great. Good, congratulations. And Jill Charles is one of our newest members of the AAFE faculty at our headquarters in Cleveland, Ohio, and helps run the AAFE Training Center. And you see her and Megan here on a lot of social media. So she's newer to this. So what attracted you? What were you doing before?
So prior to coming here, I worked as a nurse practitioner in rheumatology for almost 4 years. And similar to Cassandra, it can be very draining. A lot of my patients were in chronic pain. They didn't get any better. And it just, after putting in so much of your time and effort and energy, it's with little reward. After so long, you just really, you seek for something that's going to be more rewarding. And so aesthetics was always something I wanted to get into. And, I like the idea of being able to help people, make them feel better, improving their confidence and their self-esteem. But also I like that there's still a challenging component. It's very anatomy driven, and I like that it keeps you fresh, it keeps you on your toes, and it's a good combination so that, I can continue to advance my skills as a nurse practitioner.
That's great. And Megan is interesting because she actually got trained at an AAFE course a year and a half ago, and then tell them what you did pretty much straight from that, and then how you ended up here.
Okay, so I was working as a nurse in Utah in a float pool, so I could go everywhere in the hospital. And I loved being in the hospital. However, I was lacking a lot of consistency. One of my friends owned a spa, and she had a nurse practitioner come in on occasion and do injectables. So she gave me this idea like, oh, you should go get certified. So I did. I took an AAFE course the beginning of last year of 2018. And my day at the course, I absolutely fell in love with injectables. I loved learning about it, and I loved learning the anatomy, and I felt like I got the technique really well, and I really loved it a lot. I then took my skills. I worked at a plastic surgeon's office. However, learned that I liked injecting more than I liked being in the OR. So I wanted to do more injecting. Also there, I learned that it's nice to work with people who want elective procedures. In the hospital, you're dealing with patients who don't necessarily want to be there. And so it is nice when people, they want what you have to offer. And then just recently, I was given the opportunity to come here to the headquarters in Cleveland. So my husband and I moved from Utah to Ohio, working here at headquarters. And it is so awesome to be here, being injecting patients every day, but also being on the education side of things where we are learning something new every single day and what these products can do for the body and what they can do for cosmetics, but headaches and facial pain and all those sorts of things too. I just think it's awesome to be in an industry that's ever advancing, and we're learning new things every single day with what we can do with these products.
Right. And I want to get your opinions on this, because I think a lot of people, when they think about Botox or fillers or getting into injectables, they think, oh, it's just like a little skill and no big deal and that kind of stuff. Were you all surprised at how deep and how dynamic it's a really dynamic field? But I think people, when they first look and want to get trained, they probably think they're just learning a nice little skill, or it'll just be for fun. But were you all surprised on that when you started? Let's start with you, Cassandra.
Yeah, very much so. When it comes to Botox, at first I really was surprised at how far you can put it in people's soles of their feet. You can use it for excessive sweating. Fillers, just going over the basic anatomy and where you should be putting fillers, where you should be looking for occlusions, things like that. It's much more in depth than people think it is at first glance. Definitely.
Right. What do you say, Nick?
I mean, a lot of people they think they're just coming to, like they equate it to getting your nails done, something like that. But it actually is a medical procedure. You need prescription, to get these products. And all the things that could go wrong, you really need to know that your medical background and all of that, and how to handle those. So absolutely. I didn't realize it when I first got in, and now I see definitely you need to have
right. And you've got some really fresh eyes because you're newer to
Sure.
this. So like what did you think coming in versus like where we are now? Because and Megan and Jill are in the AAFE headquarters, so they're always trying something new because we're always getting new things here, right? So what did you think?
I knew it was going to be challenging. I mean, I sort of anticipated that from the start, but certainly it's great. I mean, it's a good challenge. It's really forcing you to learn something new every single day, and it just makes us better and better at what we do.
Right.
I think that any good injector who has satisfied patients knows how complicated and challenging this can be. Having worked with and seen injectors who don't know that, they would throw Botox anywhere in the face. They wouldn't even look at the patient or do an assessment before. And patients aren't satisfied with that because the injectors did not know the anatomy and they didn't know what could go wrong or the proper doses to use or something like that. So I just think it is so knowledge driven that you can't just be half in, half out. You have to know what you're doing in order to be a good injector and to make your patients happy with their results.
Right. And I mean, then you just get into so many other things that are happening in this industry. I mean, there are new botulinum toxins coming out. There are constantly new fillers coming out, learning all that. Anatomy sounds like so dry and basic, but we learn anatomy every day, like multiple times a day, right? I mean, we just spent a couple of days treating patients on some new procedures, and it's all about that and all about the anatomy. How do you feel of like what kind of satisfaction do you like training other people? Because these are some of our best trainers here in the AAFE, I mean, certainly on the medical side here. So what's your experience been with training with the AAFE?
I actually love training or teaching new providers to this because it's great to see their excitement and how much they enjoy everything you tell them or explain to them. They're just absorbing everything and very, very excited to get started. And that's a great energy to feel.
Right. Nick?
I think for me, I just remember when I took my first course, how excited I was to kind of come away from the everyday same thing that I was doing in the hospital to now, I got so excited on my first course and then bringing it back and doing it daily. I think being able to help other people have that same feeling is what's most rewarding for me. So I love teaching.
Right.
Definitely.
Same with me. I mean, teaching was always something that once I was in school to be a nurse practitioner, I always thought in the back of my mind, I'd like to teach someday, because you have those instructors in school who are excellent and like really have an impact on your learning and your development, and you want to be able to return the favor to other students. And so this is a great opportunity to be able to do that.
I just lost my train of thought. Cassandra talked about caregiver burnout, and that's something that I think every hospital in the nation is constantly preaching on. Like, how can we in the medical community avoid caregiver burnout? And that's something I love about this industry. And when people come to attend their first courses, they are doing something new and exciting and to help avoid that caregiver burnout. That's one of my favorite things to see. In Chicago, I had an attendee inject one of her friends, and her friend had gone through a really rough patch in life recently. And you could see it in her face. She was like sad and downturned. And after we had done full facial treatment on her or whatever, she was crying because she was so happy. And it just reminded me like what you can accomplish in this industry. It really can change people's lives.
Right. What advice would you give to someone, whether it's a new nurse or or someone that's been in nursing or medicine for a long time? Like, what advice, what should they be looking for in terms of getting into this field, aside from AAFE training? I think we all agree on that because we're all AAFE trainers, right? And when we train so many people every single week, but like what kind of, because every time I talk to a nurse or nurse practitioner, they're a lot like all of you. They just can't, they're burning out or getting burned out, and they recognize it. Nursing is tough, right? I mean, it's really tough. I mean, you talked about, patients are tough, and, and working with other medical professionals can be challenging, right? Even though we love all of our medical peers, right? But we can be challenging. It's a stressful environment. But like, what advice would you have if somebody came to you and said, I'm really thinking of making this change?
First of all, I would explain to them that your training is everything initially, and choosing the best course to start with is everything. Knowing the anatomy and how to prevent having adverse outcomes and adverse events is a major thing. But aside from that, I think that it's a very different field than all of us know in the hospital, at least. I worked probably 7 years in the busiest ER in the country. And, somebody that you would just save their life, they would cuss at you and be mad at you. Whereas now in my office, I give somebody some beautiful lips and it changes their entire life. They're going to go out on a dating website. They're going to go look for a new job because they have this confidence. And before I started this, I felt like it was more fluffy medicine per se. But now I see how much it affects people. When you really make somebody happy and really take away something that they're insecure about, they're much more likely to go for those things that they really want to do. And so I guess that's what brings me joy in doing this, is because I really feel like I affect people's lives for the better.
All right. That's great. You get a lot of people that are cussing at you, aren't you?
Well, I worked in a high drug ER.
Right. It was
high drug.
Yeah. What about you, Nick? What kind of advice would you give?
I mean, I've over the time that I've been injecting, I've mentored, quite a few different nurses and that want to get in the field. I think a big thing, like you said, with fluffy medicine, it's a lot of people do have that thought in it, but I absolutely, every single day that I'm injecting, I'm pulling from my experience in the hospital, from all the different disease processes and things and drug interactions and all of that to know that I'm being safe with my patients. So I really think that getting that, initial experience in a hospital or that acute care is important because things can go wrong. You do have patients that pass out in a course or in your office. You need to know how to respond to that. But definitely find a mentor if you're going to get into this industry, and stick with that person, absorb it all, come to courses. Do not just take one single course and think you're done. It's absolutely not that way. We can all speak to that we've taken several courses very frequently to make sure that we're up, in the industry. Right.
And that's something in the AAFE and just fluffy medicine. We're going to have to we're going to start using that term more. But
Yeah.
I mean, that's something we take very seriously, because when you come to learn about Botox and fillers or injectables, it's not a big Botox party. And this is real medical treatment. We harp on this constantly. It's about really taking, doing a medical evaluation, health history, all that stuff is really important. Drug interactions. We're going to turn away some patients that this might not be appropriate for. I mean, I think those are really serious points. I think people coming in think, oh, it's just a Botox party. Like my life's going to be a Botox party, not real medical treatment. And we go kind of crazy when we see on social media how people are just kind of, treating it, even injectors or, people that really should know better. You've got to really treat this seriously. And that's the key. That's a lot of the key.
And it's not cookie cutter at all.
Right.
A lot of patients, especially, believe that it is cookie cutter. Well, my friend Sally down the road, she got 20 units. Why can't I have 20 units? And it's really patient specific. And
that's a really good point, because a lot of injectors, will ask us, well, how many units did you give this patient? And while I'm always kind of hesitant to tell them, even on social media, when they ask a question, because it's irrelevant to your patient, right? It's irrelevant to the next patient, right? So it's really, it's not, at least the AAFE, other organizations we know really teach a cookbook kind of thing. That's a disaster as an injector. You will not be successful. It's about knowing the anatomy, evaluation. It's real medicine, right? I mean, that's what it's really all about.
Yeah, I mean, I think if someone were to approach me about a possible career change, I think, definitely it's worth going for. Before I left my previous position, I think sometimes we tend to get stuck in areas that are comfortable. And, really pushing yourself beyond your comfort zone, I think it can be a great thing for nurses or any medical professional who really is looking for a fun, exciting challenge, and is really looking to hone in on their anatomy and, their injecting skills. I think it's a great opportunity, and I certainly would recommend it to anybody.
And for the young nurses out there, right?
One thing, a piece of advice someone gave me was to just be all in. When I attended my first AAFE course, I didn't know where I was going to be working as an injector, if I would get a job as an injector. I had no clue, but I knew that it was something I wanted to try, and I knew that in the long run it would be worth the risk. And so I just paid the money and went to the course and fell in love. And it was hard trying to get started, but once it started, it's been amazing. And now I've moved 1,500 miles across the country to take a job in Cleveland, Ohio, and have this new element to my career that I never could have imagined. But because I was all in, it made all the difference in the world. The other piece of advice I would give is you have to make sure that you're doing things right. I've had a lot of people message me on Instagram or email me and say, so is this just something I can do out of my basement, for extra money? And the answer is absolutely not. Since it is a medical procedure, you would never go to someone giving flu shots out of their basement and that sort of thing. So be all in and make sure you're being safe and that you know what you're doing.
Right. I mean, I think those are all good points. I mean, I would just say from training the last 12 years with all of our faculty, it does afford the opportunity to do part-time, full-time, both of you just quit your hospital jobs, but you were doing that for a while. So you're able to do that. Megan's 100% right. All in terms of treat it seriously. It's a career, and it can be a part-time career for many to start, just like a lot of people have moonlighting jobs, right? At different clinics and that kind of thing. Seriously, but if you're committed to it, that's when you'll be able to find jobs. I mean, the whole industry is exploding. Certainly med spas are exploding. Even those, physicians that are really into plastic surgery, dermatology are opening med spas. We're seeing people across medicine and dentistry opening med spas. I mean, the jobs are coming fast and they're there, but really only if you're really, if you just treated it, took one course and think you're going to be good at it, people are not going to hire you. It's really about getting the experience. And that's really what all of us are here for. I think just to sum it up, I think Nick said it right. Find mentors and find people that really, you can talk to. And that's what the AAFE is really built on, because we're built on all that member support, all that support after courses, because we didn't want to create a course we're just going to train someone, never see you again, just take the money and goodbye. I mean, we're really created a community and a membership and a family, and that's what we really talk about all the time, because we're here to help you. All these people, all of us, our entire 30 plus faculty are all here to mentor you and help you really achieve these goals for all of that. But I want to thank all of you. It's so good to be with some of our AAFE member faculty here for thanks, but we really hope that this was helpful. And I'm sure you're going to inspire a ton of medical and dental professionals to start taking a look at this. So say goodbye to everybody.
Bye.
See you all later.